We're live. Hello, friends. How are you today? This in Michigan is a cloudy, rainy day today on Wednesday. Let's see. I need to start my app here. There we go. All right. Oh, Miss Brandy. Hi. Hello, beautiful lady. Thank you for coming in and give me some love. Love you too. Love you too. I am back. I'm gonna try to be every week now. Summer's over, no more playtime, and got to get back to business. And also, I start to get that SAD, the seasonal affective disorder, and for some reason, it's hitting me really early. Usually, I don't get it until January, honestly, but this year. I think because my fall last year was so difficult. Hey, Joe. Metal music. Long as I see Jamie, it's my Wellness Wednesday. I am so sorry, Metal Music. Miss Jamie is having phone difficulties, but she may pop in. She may. I don't know exactly if she got it fixed or not yet, but her phone has been broken and she's having difficulty contacting someone to help her get it fixed. And hey, hey Tracy. Hey, Tracy. welcome, everybody. Yeah, Miss Jamie is having some phone difficulties. So, what she did was, I think her screen is broken, and she sent me a voice text, or she tried to, and she did explain that she's trying to get it fixed. She's hoping to have it fixed soon because as soon as she gets it fixed, then we're going to start doing slumber parties every other Friday and giving away more monies, more monies. I'm so sick. I have the flu. Oh no, Joe. Oh, that stinks. Aw, with all the other stuff going on. Yeah, I have to go. I will tell her hi when she contacts me, but she only contacted me once in the past several weeks because of her phone. That's her only communications. So hopefully she'll be able to get that fixed soon. So that's the update for Miss Jamie. I know she's been incommunicado even on Instagram and Facebook. So that's why I thought she might have been in the hospital because that happens to her sometimes. She has a lot of medical issues. As you guys know here, she talks about it in our lives and stuff. But no, she is having phone problems. So, Joe, I hope you feel better. I hope you feel better. That's so yucky. Flu. And it's that time of year. Do you get a flu shot, Joe? I'm curious. I got one last year, but I was sick. I had the kidney thing going on. I didn't know it. Then I got the flu shot and then I got the freaking flu. So, I have to go and do some stuff with my kidney doctor. Hi Lois, how are you doing today, beautiful Lois? I bet you're getting that rain up there too, aren't you? We're getting cloudy, yicky. It's a yicky day. It's sticky and yicky down here. I will tell Jamie hi though, and I had a bad reaction to the flu shot before, so no, I didn't get it. Yeah, I'm afraid. I'm afraid because I think some more kidney stuff is going on this year. I have testing that I have to get done. You're loving the rain, Lois? Are you? I think if I was in better spirits, I might because it's a nice cozy. It's cozy in the house, The air's not kicking on every 5 minutes. You can hear the rain outside. Just today, I'm kind of So, yeah. The cats like it though. For some reason, the cats really like the rain. They like to go outside in their little catio and watch it. So that's kind of cool. 90s were horrible, yes, and sticky. And I'm like, we were having such nice 70-degree weather, and then bam, 90s. And then now, tomorrow, we're supposed to be back on our way to the 70s. Yeah. So I'm in the same boat, Joe. We'll see what happens with my testing. I am having car trouble right now. So I'm having difficulty getting to, it's like when one thing hits you, like everything hits you all at once. And I don't mean to complain because I love my life. I love it. I'm doing well. My husband's doing well. Um and I'm just enjoying, like this summer I've just been enjoying time with my family, out of town family, friends, just enjoying my time. So I haven't been sick, but I'm having some symptoms that I had last year at this time, and I think it's messing with me a little bit. So I have been taking my medicine religiously. Thanks, Lois. She says, I totally understand. Thank you, Lois. Yeah, so it just is kind of all hitting at once, and we're okay. We can take care of everything we need to take care of. It's just all at once, you know what I mean? So it is putting me in, I'm taking all my meds, but it is still giving me a little bit of the. Brandy said, prayers to whoever's dealing with sickness or health issues. God, please touch all these people with your healing hands. Amen. Oh, thank you, Brandy. Thank you so much. So what I wanted to talk about today is not just my problems. Well, this is one of my problems, is anxiety and skin picking. And my face was kind of bad there I think the last time I was on, it was kind of bad. So I've stopped picking my face, but I think I got sunburned or something. And so my lips started peeling, and it's been about 3 weeks because they get, you know how they start to peel? And I have been picking at them as well. So the picking of my face has turned into the picking of my lips. And it's all about anxiety. We're going to talk about what it is and how to understand it. And so I consciously have to catch myself and stop myself from doing it. And sometimes I do it. I don't know I'm doing it, or sometimes I do it and I know I'm doing it, but I have to, for some reason, I have to do it. They're getting better. Like I said, it's been about 3 weeks, but the first 2 weeks were pretty bad. They just, every day I would wake up and I had really nice and poofy lips though. I had really nice. Hello, this is Jamie. I'm borrowing one of my mom's phones, but I couldn't get on my channel, so I made this one. Okay, Jamie. Jamie's here, everybody. Jamie's here. Welcome, Jamie. How are you doing today? I was telling everybody about your phone. So we just wanted to make sure you were okay and that you were in the direction of getting it fixed. And yeah. So let us know about that. So we're going to talk about what it is. I've got a couple articles that have some helpful hints, but my favorite place to go is called Picking Me. Let's just go there. Let's just go there and see. Picking Me. So this woman, and she's young, but she is in her 20s, I believe. I'm trying. Amelia and Jaren are horrible at helping me. LOL. Yeah, unfortunately, and that's been true for quite some time as well. So Tracy says hi. I'm so glad you're here, Jamie. We were a little worried about you, but then when you called me and told me what was going on, I did get your message. I don't know if you saw my text back, but I'm like, don't worry about it. Take care of the business that you got to take care of. And I was telling everybody, when you do get your phone ready, because I'm back on Wednesdays, every Wednesday, as long as I can, but I said, once you get your phone done, then we'll start doing slumber parties again. So we can give away monies. So, yeah, I'm so glad you're here. So this is Picking Me Foundation. She started this foundation. There was no, I need to put the fan at me a little bit. Sorry, guys. I don't know if my butt's in the shot or not. Sorry about that. The fan, I'm a little bit hot. No, I can't read it. Sorry. No worries. Um, so she started this website several years ago when people weren't even really talking about it, because there's a lot of shame with this disease, picking, skin picking, hair picking, lip picking. And I know several people who have different forms of this. And just because you pick a zit, that doesn't necessarily mean that you have a skin picking disorder. And we're going to talk about that as well. What it is and how you can tell if you have it, if you need. There is no cure right now, but she is really on the forefront. She's really the only resource. Now, I found some stuff from I think the Cleveland Clinic, the Harvard Clinic. These are articles, and another one. So we're going to look at those as well. But she really is the leading what do I want to say? Like, I'm advocate. She is one of the leading advocates with this. She does have the disorder, and she started this because she couldn't find any resources for herself. So it's an interesting website if you're interested. She knows a lot. We're going to look at some different articles that's on her blog. And yeah, it's just not a lot's known about it. People usually just say stop picking. You might yell at teenagers or kids, just quit picking, And there's a point where it's just normal. It's just, normal stuff. But there is a point where it becomes a problem. And especially with kids, it's difficult to tell, you know. And I'm hoping today that we will find some information about how to tell with kids, how to tell with ourselves. If you know someone who has it, how to talk to them about it. Because you don't want to yell, just quit picking your face. It doesn't work like that. And we're going to delve into that as well. I don't know how many episodes we're going to do, but we're going to start with this one here. Oh, my husband's home. Okay, let's go to the bigger screen with me in the corner. Okay, this is actually the woman who started the website. Her name is Laura or Lauren. Share these. Yeah, Lauren McHenry. Lauren McHenry. So these are just different, and that's her right there. And the reason I would have to say that it comes and goes, but when it comes, it's not the same as just, scratching a boo-boo. It's a lot different than that. So it's called dermatillomania is what skin picking is called. And then these are just helpful articles. We're going to go down to lip acne and skin picking disorder. We can go to that one. So it's not opening anything up. I guess we'll just read it on the page. It's not very big. Come on. Move away. Sorry, technical difficulties. She doesn't have this in articles. She has it in little. Oh, okay, I see. It's this one right here. All right. So can I blow it up? Acne. Let's see. Can you guys see this right here? I'm going to come back and see if you can actually see this. Let's see if you can see the screen. No, you cannot. It opened another screen. Yeah. Okay. Let's go to hi. We're doing Wellness Wednesday. We're going to stop that screen and we're going to start another screen so you can see. There it is right there. Okay. Share. All right. Let me go back here so we can see if there's any comments. Jamie says, I pick my arms. Jaren doesn't. My dad picked the same sore for 20. Oh. Happy Wednesday. Wellness, beautiful ladies. Just wanted to say hello before I missed your live. Thank you. Wavy like the ocean. Welcome, welcome, welcome. Okay. Now let me get back to this one right here. acne and skin picking disorders. So, for me, it started with acne, but I did not develop this like I did when I was younger, but not to the extent when I was older. I didn't. If I had anxiety when I was younger, I think I did, but it was more severe when I was older. So the skin picking was more severe. Okay. Just because you have skin picking disorder does not mean you have acne, or just because you have acne doesn't mean you have SPD. And SPD is what she says it is, but the technical name is dermatillomania. People struggle with skin picking often see a dermatologist first, thinking it's only a skin related condition like acne. Dermatillomania is often thought of and treated first as acne that might clear up some triggers, but picking compulsions remain. Dermatologists need to be better informed on how to best work with clients who have the disorder and acne, such as offering topical solutions and wipes to lessen skin to skin contact. Skin picking causes us to scan our skin, which can fill our pores. I was hoping for a little bit more backstory. So let's go to, we're going to come back to StreamYard. We're going to go to the basics. I have a bad habit of peeling my lips. That's what I've been doing. Hey, makeup nurse, how are you doing? My aunt and daughter has skin issues. Yes. Yes. I think a lot of people do. It just, where does it become a condition and where is it just like normal, scratching? And I have to say that I have really sensitive skin. So, like, I can, if there's dirt in the bed or crackers, my husband likes to eat cakes. I'm doing good. Thank you. And how about you? I'm doing pretty good. Okay. Bye, everyone. Have a blessed day. Have a great day, Lois. Thanks for stopping in. It was so good to talk to you. Bye. Okay. Present, share screen. And we're going to do the first one, skin picking, how to stop it. What's this one? Is this the Harvard one? That is the Harvard one. That's not the one I really wanted to go to. I've recently started peeling my lips, but it's because they got sunburned and I quit scratching my face, but I still have the anxiety that makes me pick. And yeah, that is what's been going on with me lately. Okay, so not that one. Not that one. Let's try this one. How to Stop Skin Picking TLC Foundation. Let's go to this one. Okay, I think this one is Cleveland Clinic. Okay, that's the one we're going to go to. Let's get rid of that. Okay, so I'm going to come back. Okay. Hi, Neen UK Vlog. How are you? I'm good. I'm very good. So, what we're going to do is we're going to go, like you can see it right now. So we're going to go over here. Is this at Cleveland Clinic? Okay. Dermatillomania is the technical term for it, and it's skin picking. And like I said on the website, she calls it SPD, skin picking disease. So, or disorder. Dermatillomania, also known as skin picking disorder or excoriation disorder, is a mental health condition where you compulsively pick at your skin. This can cause injuries, infections, and scarring, leading to stress, anxiety, and a reduced sense of well-being. This condition is often treatable with a combination of medication and therapy. It's treatable. There is not a cure for it. Okay. What is it? It's a mental health condition where a person compulsively picks or scratches their skin, causing injury or scarring, also known as skin picking disorder. This condition falls under the category of OCDs. When it leads to significant scarring injuries, this condition can severely affect a person's mental health, well-being, and quality of life. It is pronounced dermatillomania, gets its name from 3 Greek words. Derma is skin, tillo is pulling, and mania, excessive behavior or activity. All right. What is the difference? Leads to the name of the category. What dermatillomania falls under is the overall category. It still has some key differences from specific conditions. OCD involves obsessions, which are thoughts to urge a person. Those kind of obsessions don't happen with dermatillomania. When people with dermatillomania pick at their own skin, they often feel relief and other positive emotions. This does not happen with OCD. OCD rarely involves any kind of self-damage or self-injury. With dermatillomania, that kind of self-injury is extremely common. In years past, experts believe the condition was much more common in women. However, recent research shows that only about 55% of people with the condition are women. Women are most likely to seek treatment for this problem. This condition usually starts during puberty, but can happen at any age. It is also more likely to happen to people who have triggering conditions like acne or eczema. How common? It is an uncommon condition with an estimated 2% of people having it at any time and up to 5.4% of people having it at some point in our lives. Dermatillomania causes people to pick skin compulsively. For some people, picking is an automatic movement. They may not even realize they're doing it, and that's important to note. Others are aware that they're doing it but can't stop themselves. So those are two very important things that I would like to talk about. Let's go back to StreamYards. A lot of people don't realize. I will try to watch your video later. Sorry, love, I have to head out. Have a wonderful day to you all. Have a great day, Wavy. Hi, Envita. Do you have an Instagram? Because I have your email, but I was hoping you had an Instagram because I need to chat with you, if that's okay. If you do, and you don't want to put it in the chat, mine is at Real Lady Electrician. And you can contact me there. But if not, I will email you my questions for you about the package that I'm sending you. So, how are you these days? It's been a while. Oh, you've been here before, Nini? I don't remember you. I am so sorry, but it's great that you're back. I hope you're doing well. I hope you're doing well. And have a wonderful day, Wavy. Excellent. Thank you so much. At Real Lady Electrician. So, and then we can follow each other too. So, yes, it's just like instant chatting is just a little easier for me than email. So, one of the things that I do want to talk about is how it's not, let's see, my bigger, okay, how it's sometimes you don't even realize you're doing it. And that's a sign that you have the compulsion. So if you find yourself picking your skin to the point of injury, which, it starts out as a little pimple and then it grows into a big sore, but I can't put link because I'm not a mod. Oh, don't worry, Jamie. Don't worry. I'll put it in there. Let me see if I can share my link. Oh, I can just make you a mod, right, Jamie? Go to channel, remove report, go to my channel. Jamie, she's on my channel, but I can't put link. Pin message, report, remove. No, I don't want to do that. I want to make you a moderator. Why is it not letting me do that? Cancel. Okay. Add as moderator. There we go. Jamie is now a managing moderator of your channel. There you go, Jamie. I have messaged you on Instagram. Thank you, Invita. I will contact you after the live because I do want to take care of it today. Because I've been late anyway. But let's see. Okay, so what I was talking about is one thing that you need to know about the disorder is sometimes You pick and you don't even know it. Now, what I said earlier was don't yell at people who pick their face, because that causes them to feel shame, and then that makes them anxious and they do it even more. So I want you to understand that I personally have given my family and friends permission to tell me to stop picking. Now, that's me personally. A lot of people are not comfortable with that, but sometimes I do it and I don't know I'm doing it. So that's one thing. The second thing was some people know they're doing it and they still can't stop. Now, I've been there too. I know I shouldn't be doing it, but it's very like irritating to me. And so the parts that are irritating I will pick at them. Let's see. I bite my nails really bad. Yes, makeup nurse, that is a compulsion as well. Yeah. We can probably address that later because I think that's very common as well. Let me put that in my book. Where'd my book go? Now, I don't do that, but that's just because I don't do that. That's not, I still have compulsions. So we'll find out what nail biting is called and we'll do some stuff on that too. But that's what you need to understand, that a compulsion is something that we just don't have control over. So even though I know I'm doing it, I can't, even in my mind, I'm like, Crystal, you're picking your lip. I can't stop. So, all right. Thank you, Jamie. I wasn't aware of this disease, compulsion. Yes, it's not super common or it's undiagnosed a lot. So you may see someone like I have scars everywhere, to be honest, on my arms as well. They look like freckles, but a lot of them are scars. I do have freckles too, but there are a lot of scars. This is my main area in my face. So what I was doing is, even though I would do this at least twice a day, I had sores all over my face. They started out as pimples or bumps, and from continually picking them became infected sores and scars on my face. Um, and even though I looked at myself in the mirror and I said, it's really ugly, I didn't like it. I didn't know what it was. Like that was in probably 2016, maybe. And that's when I found Laura. So I didn't know what it was or why I was doing it. I had no idea. Hey, makeup nurse, welcome. Thank you, Jamie, for dropping that. So that's the thing. People just kind of brush it off and say, well, just quit doing it. Well, it's a lot harder than that. It falls under, like we said, the OCD umbrella. That means that there are under the OCD, there are many, many, many diagnoses under there. And this is one of them. And that doesn't mean it's like every other OCD. It just means that it falls under that umbrella. So, but yeah, I had sores that hurt and I just would still pick them. All I needed was a scab and I just would pick, and I have little razor nails. They're little thin razor nails. I can scratch myself and accidentally bleed if I'm not careful. But yeah, razor thin, sharp nails, which is not good. Both my sisters and my brother have this issue as well. I haven't heard anything about it being genetic, but we all have anxiety, which is genetic. So what was the second part of that I wanted to? Okay. You're aware, but you can't stop yourself. And I've been in that situation recently where I know what I'm doing, but my hands, it's like they have a mind of their own. I don't know if anybody saw my post on Instagram, but it was probably several weeks ago. It was a tissue with little spots of blood all over it. And that's something that people who pick their skin will understand. I posted it and I just put, if you know, you know. I was having a really bad day. I couldn't stop myself. I didn't know what to do. So I posted it and I got a few comments back, and I felt better. I felt seen, I guess. And so that helped me a lot. Because what happens is you pick your face, you don't even realize, and then you're bleeding, which we know is a biohazard. You don't want to be out in the public bleeding because people will have a reaction to it. So you take a tissue and you try to stop the bleeding. And then by the time you're done with the tissue, you have a tissue with a bunch of little blood spots on it. And that is so common. That happens so often. Um, and it's just that I don't want to be in public bleeding because I know that it's going to bother people. It bothers me. Um, and there are just sanitary things and stuff because I don't really like dirt, and I don't like to pick my face. I don't like to infect myself, but I do it compulsively without realizing what I'm doing. So let's go back and hit that article. We're going to shut this Harvard one because it's not really what I think I'm interested in. Okay. How does it affect my body? Let's see. Causes the person to pick at the skin. We already talked about that. For some people, picking focuses on area of the skin that are rough and already have some kind of blemish or irregularity, like pimples, or say you already have a scab, a sore. What else? Like we said, like she's like Makeup Nurse said, her nails. I can't remember who said their lips. I think it was Wavy like the ocean. But yeah. So so it's we've already discussed that it is a compulsion. So let me go to the article again. We're gonna go right here so you can see where I'm at. Management tips. Good afternoon. Hey, Nightingale. How are you doing today? Hope you all had a great Labor Day weekend. I did. I had a really good Labor Day weekend. All right. So today we're talking about skin picking disorder, dermatillomania, and then any disorders that fall within that range. So let's see. Picking focuses on areas of skin that are rough and already have some kind of blemish or irregularity. That's true. Pimples, patches of dry skin, scabs over cuts, and scratches. Picking can create new wounds and reopen old ones. At my worst, I was reopening old wounds on my face. That was when I was at my worst at a job that I hated, and I just had so much anxiety. I had no control over it. So there is. I took my medicine, you guys. I don't know why I keep getting. Let's see. Oh, new wounds and reopen old ones. Yeah. So, and also, if I get a pimple and I just keep scratching it like daily, and then I get a scab, and then I pull the scab every day, it just keeps getting bigger. And then if my hands aren't clean, which I'm really fastidious hand washer, but sometimes you get stuff on your hands and you don't realize it, I will get infected. And then it becomes a big sore. And I was at the point, it was so bad. It was so painful, it didn't matter. I still was picking my face. Even though it was so painful and it hurt so bad, I still did it without even realizing it again. You guys know that with anxiety, how you can get in your head and you're just not present and you're not paying attention and you have things just mulling in your mind. And then all that time I'm picking at my face and I am not being aware. I'm not in the moment. I am somewhere else worrying about something else that possibly I had no control over and no coping skills. Those were my coping skills. If I'm not typing, I'm listening. I'm getting ready to drive to my doctor's appointment 2:30, but I'm here. No worries, Jamie. We're just glad you're here. No worries. Okay, so let's go on to the next. bit here. I get that. I bite my nails and they bleed and it hits for yeah, it hurts. It hurts, and sometimes that still doesn't stop you though. You know what I mean? Like you're so just not even in the moment. Yeah. Mhm. Yeah. All right. In rare cases, infections from the wounds can spread through the body, leading to an overwhelming immune system overreaction. It can get very serious. So, one thing that I did do, it was totally, I wasn't thinking about it. I had a scratch, I think from shaving on my legs. And I have those varicose veins that are like big veins close to the surface of your legs. And wasn't thinking, picked the sore, started bleeding like profusely, like shooting out blood. I had to call the ambulance. And I didn't lie to the doctor. I said to the doctor, I picked my leg. I know what I did. I didn't mean to do it. I didn't want to do it, but I did do it. And sometimes addressing it in that way can be helpful, but if you have a lot of shame around it, it's and no support. And I had my husband's support. And if you don't have a lot of support, it's difficult to do something like that. So, yeah, it was bad. I had to go by ambulance. My husband was at work. I had to go by ambulance to the emergency room. They did their best to, pack it to stop it from bleeding, but I had to have stitches. And even to this day, when I'm shaving, I worry about that spot, but I haven't picked it again. I haven't done that again. So, yeah. Um, but it was very scary for me, and I knew it was serious before that happened, but and that was when I think when I first went off work, or no, I was home from work when that happened. I had to go to the hospital. I don't remember where I was working at the time. I just know that it happened a while ago, several years ago. And I haven't done that since. That was very scary for me. And I try to watch myself. I don't know if any of you guys have tried the those patches, those clear patches you put on zits. That really helps me a lot, especially like I said a month or two ago, my last live, I had a lot of spots. And so so I put those on. I've already done the damage, but I put those on to stop myself from picking, and that really helps a lot, because once it starts to heal, then I am much. And those patches, when you go to scratch, you feel the patch and you catch yourself. It's like a tactile, it's like I'm doing this, I need to stop kind of thing. Sorry, I'm not talking much. I'm just sick. I only pick when I'm anxious. Yes, but then I can stop even if Jason says to. It's hard. It's hard, especially when you're anxious. It's very difficult. And that's what I want to tell people, is that if you know someone who's doing it, just saying stop it is not going to help. If it's at the level that I'm telling you that I was at, saying stop is not going to help. We have to learn coping mechanisms. And sometimes, like I told you with my lips, I just couldn't stop. It was so irritating to me. It would get really dry right here, and it would be rough. So when I would do this, it would be like very pokey, and it would hurt, and it irritated me, and I would pick it. That's what happens. I get irritated, and I have very sensitive skin, so I can tell when I have a pimple. I can feel it on my back or my legs or whatever, even if I have clothes on, and I will go at it. So, yeah, no worries, Joe. We know you're sick. We just want you to get better. So, yeah, and sometimes, like, even when someone catches me, I still might do it again. Like, I might, oh, I'll stop, and then not realizing it, start up again. So it's very difficult to control. I do know that it doesn't start with shame. What happens is you start to feel shame about your appearance, about your inability to control your hands, about just, like how you look overall, or you get worried about the infections and things, but it doesn't stop you. It doesn't stop you. It's like your hands have a mind of their own. Okay, let's see what else we got here. Let's see. Picking can create wounds leading to bleeding and scarring. I do have a lot of scars. When this condition is severe, it can lead to skin damage that's extensive enough that it may need surgery, such as skin grafting, to repair the damage. Infected wounds may also need antibiotic treatment. In rare cases, they can spread through the body. Okay. An immune reaction. Sepsis is a life-threatening medical emergency. Mental health effects. Often people with these conditions feel embarrassed or ashamed of the visible injuries, trying to hide them with clothing, makeup, or other means. Because of that, this condition can be a source of anxiety, depression, or social isolation. This condition can also affect people's work and social lives. And that is true. So what I did was, oh, okay, Jamie, don't worry. You're fine. You're fine. So what I did was, I told my family about it. I didn't want to be ashamed of it anymore. I told my friends about it. And that, um, and then actually when I see them, I just tell them what's going on. I pick so bad and twirl my hair till it falls out. Yes, Nikki. Yes. ASMR plus. Okay. I hate it. Yes, I know. It's you well, you feel hopeless. You can't control yourself. And like I said, you're in your head, you don't even realize you're doing it. Um, and I totally understand. Yep. Yep. Okay, now let's go. Where are we at? We were here. I need to put you back here so you can see. Okay. So, yeah, so that's what I did. I continued to go out in public, just use a fidget toy. I have a fidget toy. It doesn't know because you're in your mind and you're not controlling your fingers. How are you going to remember to get a fidget toy when you're anxious? I have them. The last thing I'm thinking about is going to get that fidget toy for my fingers. So the best for my face and my arms are the the acne stickers. When I touch them in my mind, I have a sensory awakening, I guess, and I go, "Oh, I'm not supposed to pick there. That's a deterrent for me." So that's the best thing for me. But now for my lips, I don't have those for my lips. So my poor lips, like I said, they were nice and pouty and pink. Not necessarily a good thing. Yes, yes. Give that a try if you can. Like I said, I can't put it on my lips. Um, and I did my best to not lick them. I don't lick them, but I think I got a sunburn. First I had chapped lips, and then I think because they were chapped, I got a sunburn, and then it was out of control. I'm doing better now. It's healing now. And I am doing my best. I still catch myself doing this, scratching at it, but I am doing my best not to mess with that. Yeah. If you guys have any other ideas on how to curtail the picking, feel free to put them in the comments. If there's anything you do specifically for whatever it is that you have going on, nails or hair or skin, whatever you have going on, let us know in the comments because that will be very helpful to someone. Okay, what are the symptoms? The main symptom of dermatillomania is compulsively, meaning the impulse or urge is impossible or incredibly difficult to resist. And that's the truth right there. The impulse or urge is impossible or incredibly difficult to resist. Picking at your skins. Expert also described the act of skin picking using the following words: scratching. My mom always says digging. Quit digging. Squeezing, rubbing. Picking usually involves fingernails and fingertips, but can also include biting with your teeth when the skin surface effect is on your lips. It can also involve sharp items like tweezers or pins. Now, what I find though is if I do use tweezers, like on an acne situation, that I don't usually pick that. Let's see. When I have fake nails, I tend to not pick as much. My sister did that. My younger sister, she is as bad as me with it. Um, she has done that before, the artificial nails. But I can do my own nails. I just don't. Um, and I know it would work if I did because I have these little razors right here. Okay. I try artificial nails, but that doesn't help very much. It's hard to keep them up. Yes, that's exactly it, makeup nurse. They grow out, you got to get them filled and all the things. And I don't make the time for that. I know if it's important, you make the time. I don't make the time for that. And I don't put it like high up on my list of things to do. But my sister will go and get her nails done, and she has a lot of success that way. Hey, Zach, how are you doing today? We're talking about skin picking and compulsion. Exactly. It's too expensive. It is expensive. Yes. Yes. And I tried the press on ones. Miss Jamie uses those and they always look beautiful on her. They do help, but here's the thing with the press on nails. I pick at the press on nails. That's the problem. It's kind of I have to control it with my anxiety meds and therapy and things like that. That's what works best for me. Coming here and talking to you guys about it helps 1,000,000%. I can't tell you enough about how this isn't just for you guys. This is for me too. This is therapy with my friends, with my peers. This is so helpful for me. Oh, you're working, but you're on a 2-hour break. I'm so glad you got to talk to us, Zach. Come in here and see what's going on. How are things where you're living? I haven't looked on the internet, but I'm hoping that the wildfires finally stopped. It seemed like they went on forever, forever. So I hope that that's better for you, and I hope work's going well as well. As well. Okay, now let's go back to the screen and see what else we got going on here. Okay. I'm gonna go back. I just saw a comment come up. Hi, Zach. Got earbuds in. All right, Zach. All right. This activity usually happens in one of two ways, automatic or focused. Okay, this is types of picking. The kind of picking often automatic. This kind of picking often happens without a person thinking about it. Experts sometimes call this scanning because it tends to involve running hands or fingertips across the areas of skin to find any areas that feel different, which might then become an area for focused picking. Focus is the kind of picking is focused on a specific area. The picking can go on for hours. This kind of picking tends to be more severe and is more likely to cause damage to the skin. I would have to tell you that I have dealt with both ways, automatic and focused. Yeah, I have dealt with the automatic picking. That's the main thing that happens to me. That's the main in my life is the automatic, the scanning and feeling the bump and then scratching and then making it worse and things like that. So, like I said, they say don't use tweezers and things like that. I'm the opposite. If I get the pimple to where it's gone, I don't pick at it. If I still feel the bump, I pick at it. So, you gotta figure your own routines out. You gotta figure your own mental health out, with help hopefully of therapists, psychologists, psychiatrists, whatever you can do. Um, because it's different for everybody. Nobody's the same. And that's why it's difficult for them to diagnose this, I think. And also, again, people dismiss it like, oh, just quit doing it. Just quit doing it. Well, it's not that easy. If it was, and I did have to go and explain this to my family. I picked my head because I got psoriasis. And that's one of the things too on the Picking Me Foundation website is eczema, psoriasis triggers. Acne is a trigger. Your lips peeling is a trigger. All those kind of things. Um, Do you do it even when you don't mean to? And is it painful, Zach? Because if it is, you may have what's called trichotillomania, which is the hair pulling, hair picking thing. Like if you have bald spots or anything like that from pulling your hair, picking your hair. But it sounds like you're picking the skin. So it still would be a type of dermatillomania, I think. I am not a doctor. I'm not diagnosing. I'm just trying to help you guys look online, find resources. When you go to your doctor, use the words to tell them what you think is going on so they will understand. Because, like I said, a lot of people have the attitude, just stop it. And it doesn't work like that. It's much harder than that. I'm going to fix my lid here for my coffee. I was tired this morning. So, yeah, Zach, that's a trigger. And if you find yourself doing it until it hurts or doing it without knowing it, making scars, making it worse. I don't know a lot about psoriasis, but I would imagine the more you pick, the worse it gets. So, yeah. Okay. Let's go back to here. And we'll go here. All right. Where it happens on your body. Picking tends to focus on certain areas of body. These are the ones that you can mostly easily reach with your hands, including head. There you go. There you go, Zach. Face, scalp, and neck. Arms, fingers, hands, and forearms. Legs, thighs, calves, feet, and toes. What causes the condition? There aren't any confirmed causes of dermatillomania, but experts suspect a few different factors might play a role, including genetics. People with dermatillomania are much more likely to have at least one first-degree family member, meaning a parent or a sibling, who also has this condition. And that is true. I told you all of my siblings have this condition. There are 4 of us in total. And we all suffer from some type of anxiety. Changes in brain structure. People with dermatillomania are more likely to have some key differences in the structure of brain areas that control how they learn and form habits. Stress, anxiety, and other conditions. Dermatillomania might be a coping mechanism for other issues or mental health conditions. It might also be related to boredom or other issues. Now, I don't necessarily agree with the boredom thing. I don't think we do it because we're bored. You may start doing it because you're bored, but I think when it gets to the point of being painful or scarring and things like that, I think at that point it's no longer boredom. I think it's compulsion at that point. So that's just my opinion. Again, I am not a doctor. All right. Let's go to the next one. Let's see, other conditions that will happen with dermatillomania. People with dermatillomania are more likely to have other mental health or medical conditions. Some of these include OCD or other OCD-related disorders like trichotillomania, hair pulling, there we go, or nail biting, onychophagia. I know these are Latin words, but we were talking about nail biting. Onychophagia. Okay. And the trichotillomania, I think we've talked about before, the hair pulling. It's the same. It's similar to picking, but it involves pulling hair and pulling the hair out of your eyebrows, out of your face, pulling the hair out of your head. And it's just more of a pulling type thing than a picking type thing. So it says it can also happen with anxiety disorders, bipolar disorder, Prader-Willis syndrome. Is it contagious? It is not contagious. It cannot spread from person to person. That's important to note too. It is not contagious. Even though it looks yicky and it can be infected, it is not contagious. Skin picking. It is a mental health issue. So again, I've never thought it was contagious. I don't know. I don't know. Maybe there are people out there who think it is. It could resemble chicken pox or something like that, where you're scratching at your scabs and things. But yeah, I didn't know that anyone really thought it was contagious. So because it's something I do to myself, and it's a mental health issue. So I've never thought mental health issues can be contagious. I guess that's because I've been like a student or an advocate of mental health for such a long time. All right. How is it diagnosed? All right. Dermatillomania involves a combination of a physical exam where your health care provider looks for signs of this condition on your body. They also ask you questions about your medical history, your life circumstances, any behaviors that might be related to this condition, diagnostic and lab tests, but are really needed to confirm the diagnosis. No, I think the best way to be diagnosed is to go to a mental health professional. I don't know if going to your regular doctor and getting all these physical exams and things are what would be helpful. So if you suspect it, or if you suspect your kid has it, or someone you know has it, I would definitely recommend a mental health provider. So diagnosing this condition requires meeting all 5 of the following criteria. Okay, so there are 5 criteria to diagnose this condition. All right, let's see. Okay, we're in the same on our comments. Okay. So let's talk about the 5 things that you're required to meet all 5 things to be diagnosed with this. Skin picking that's ongoing or happens repeatedly. I would put yes. Multiple attempts to stop skin picking or to do it less often. Yes. Negative impact on various aspects of your life, including your work, your social life, because of shame, embarrassment, or other similar emotions. When I first did that, yes. Now I am overcoming the shame and embarrassment of it. I am, well, you guys know I'm pretty vocal about mental health issues, and I'm like that in my regular life as well. People get tired of me speaking about it, my family members, most definitely. But yeah, um, that part I have overcome, but I did deal with that. So, skin picking behavior doesn't happen because of any medical condition, such as scabies or other skin related conditions, or because of a drug. That's correct. It doesn't happen because of any medical condition. Okay. The skin picking behavior isn't because of another mental health condition, such as body dysmorphic disorder, where you pick at your skin because you believe that you have a problem with your appearance and you pick at your skin to try to fix that. Okay, no. I mean, the skin picking behavior isn't because of another mental health condition. I notice it gets worse when I have anxiety. And I don't think it's a problem until I have anxiety. So for me, I would say that this goes hand in hand with anxiety for me. So I don't know if that's a true statement. Your skin picking disorder isn't because of another mental health condition, such as where you pick at your skin. No. So that one, I don't necessarily agree with that. What tests will be done to diagnose this condition? Medical tests that are used with this condition are almost always to rule out any other medical condition. Your healthcare provider can best explain what tests they'd like you to run for your specific case and why. And I again say a mental health professional is going to be the best. Hey, random Zach, thanks for the pepperoni. Are you eating lunch? Yeah, I would definitely go to a mental health professional. I mean, you can start with your doctor, but general doctors, your primary care physician, is not necessarily knowledgeable in this area, and especially if they're not willing to learn anything or to listen to you, I would definitely go to a mental health professional. And if you can, when you make an appointment, you can try to get, yes, I had chicken strips and fries and a bun. Oh, okay. That sounds good, but pepperoni pizza sounds really good too. So mental health providers are good. Hey, Deb, how are you doing? It's so good to see you. Mental health care providers are going to be better at diagnosing this condition, in my opinion. And now that if you get a crappy mental health care provider, then I could be totally wrong, but I have a good mental health care provider. And as you all know, I've been diagnosed with anxiety, depression. I believe that is it. It's just severe anxiety and depression. And along with that goes the skin picking disorder. Like I said, with my anxiety. Now, are they 3 separate conditions? I don't know. I don't really think doctors know either, but I do know that I'm really sensitive. Like if my husband just touches my back, I itch. He's got to scratch it if he touches it. So, and where was I going with that? I mean, you can start with your doctor, but I also recommend a healthcare provider. Oh, you can ask when you make your appointment or when you go to see someone, do they specialize in all your symptoms, skin picking disorder, coping mechanisms, whatever else, you know what I mean? Like anxiety, depression, skin picking disorder, addiction, whatever it might be. You can always ask for someone who specializes in that. And that again doesn't mean you're going to get the best mental health care provider for you. Sometimes you got to go through a few to find the best one. So, all right, let's go back here. And let's go up here. Okay. Management and treatment. How is dermatillomania treated and is there a cure? Treating dermatillomania usually involves a combination of medication and therapy. Research shows that combining the two tends to help more than just one type of treatment alone. And I do both, but that's also because I have anxiety as well, which I think goes hand in hand with that. Even in my family, my brother has anxiety, he picks. My sister has anxiety, she picks. My other sister has anxiety and she picks as well. So, antidepressant, the most likely medications for this are selective serotonin reuptake inhibitors, which I do take one of those. Anticonvulsants, a medication to help with uncontrollable muscle movements. Can in some cases help with dermatillomania. And I don't want to discourage any type of treatments, but in my case, that is not the case. So antipsychotics help by modifying the balance of your brain chemistry. The medications commonly treat many conditions like dementia, bipolar, and schizophrenia. How they can help treat conditions like dermatillomania. Nutraceuticals. These are nutrition-related products that can also affect medical or mental health conditions. For dermatillomania, research has found that amino acid supplements and acetylcysteine can help reduce the urge to pick. Psychotherapy can help treat this condition in various ways depending on the therapy used. Habit reversal therapy, group therapy and peer support, cognitive behavioral therapy. This method involves teaching coping mechanisms and strategies to help change behavior. Acceptance and community therapy. This therapy method helps people change behaviors like skin picking by accepting negative feelings that fuel this behavior. Mindfulness and other positive coping mechanisms also play a role. And this community therapy, this is what Lauren from Picking Me does. She is a non I'd have to go back to the page and find out, but how soon will I feel better? How can I reduce my risk? How can I accept I have this condition? What is the outlook? Okay. So we're going to close that. Go back here. Okay, and let's go to the other one. It's 235. Present. Let's go to the other article that I had. Share. Skin picking. All right. Oh, the DSM-5 diagnostic criteria include. Now, these are probably the 5. These may be similar, but they're not the same as those other ones. Recurrent skin picking is a result of skin lesions. Repeated attempts to stop the behavior. The symptoms can cause clinically significant distress or impairment. The symptoms are not caused by a substance or a medical or dermatological condition. And the symptoms are not better explained by another psychiatric disorder. Those 5 make much more sense than the other 5 we looked at. So let's see their definition of skin picking. Occasional picking at cuticles, acne, scabs, calluses, and other skin irregularities is a very common human behavior, which is what we were speaking to earlier. Since it's so common, people who have it to detriment are oftentimes are told just stop doing it because, that's what a normal person can do. Someone with a chemical imbalance like myself or other people who have this issue, it's not that easy for us, okay? Research indicates that approximately 2 to 5% of the population picks at their skin to the extent that it causes noticeable tissue damage and marked distress or impairment in daily functioning individuals who experience skin picking. Individuals who experience okay. Tissue damage and marked distress or impairment. Okay. Impairment in daily functioning. Individuals who experience skin picking, touch, rub, scratch, pick, or dig into their skin in an attempt to improve imperfections, remove rough patches, scabs, or smooth areas. The behavior typically begins in early adolescence, although skin picking disorder can begin at any age. Now, another thing I want to talk about is I have to tell you, I think I've always had it. Oh, have a good doctor's appointment, Jamie. That as an adolescent and you have acne, you sometimes pick at your scabs or your pimples. So I did have that when I was young. I did not pick my face until it scarred, until I became older. So what I want to say is I probably had this issue mildly in my teens, but as an adult, when my anxiety became out of control, that was one of my coping mechanisms. And that's when it became a problem. So I think that I have always had the inclination to pick, but not to the detriment of myself. Once I became older and the anxiety got so much that I could not handle it, that's when I started to scar myself basically and have difficulty. I'm trying to say, was it 2016? We said, yeah, I think that's the year my dad passed away. And also I was in a very hostile work environment that really played a part. But once those two combined, I was out of control with it. So you may have had some, not really issues, but you may have done that in your teens. But you weren't diagnosed with a disorder until it became so much that you have no control over it. Am I making any sense? At least in my case, that's what I'm thinking. So I think I was always inclined to do it, but once I had the anxiety so bad, so severe, it became a, and again, there is a release of, was it serotonin or dopamine? I can't remember what they said, but it actually gives you a release, a physical release of a neurochemical. And that is what causes you to continue to do it, is that that chemical makes you feel better. Maybe not 100%, maybe not, you know, but it makes you feel better. And some relief, as we talk about here all the time, in accordance with pain, with mental health issues, some relief is better than no relief. And that's what happens is you feel that serotonin or whatever the chemical is you release when you do that, and your brain goes, oh, so for like a second you feel good, or you feel better, I should say, because it's not like you get a high or anything from it, but you do feel better because you get that release of, I want to say serotonin. We would have to read more articles to find that out. So there is actually a physical release of a neurochemical in your brain. So that does have something to do with the actual picking. It's not just doing it. There's also a neurological there's a neurological stimulus, I guess I'm trying to say. I'm not a doctor, but it makes you feel good. And it's been chemically shown that's what happens physically. So it actually releases feel good chemicals in your brain. Now it's just temporary and short lived. But again, we talk a lot here about some relief. When you need any relief at all, a small amount of relief is better than no relief at all. And that seems to apply to a lot of things in our lives, a lot of things, especially with chronic conditions. Like, wouldn't I love to have a day where I don't have any anxiety at all? But that's not happening right now. Not at this moment. Okay, let's go back to the article. Okay. So again, I think it started with me when I was younger in my teenage years, but it didn't become a problem until I became older. Skin picking disorder is currently classified as obsessive compulsive and related disorders in the Diagnostical and Statistical Manual of Mental Disorders 5th edition, DSM-5. This is what your therapist, psychotherapist, psychiatrist, this is the book they use to diagnose you. I've seen one, my therapist pulled one out one time. I think when I was being diagnosed with depression or anxiety, she showed me what it was. Excuse me. And that's how I know about it. But I don't have a volume of that. I'm not interested in that. But your doctor, therapist, mental health care provider, your regular doctor probably doesn't have this because it's all mental health related. Okay. Signs and symptoms. Oh, this is tiny writing, you guys. I don't know if I want to read this. Impacts and effects. This looks like a lot. Treatment. Okay. It says research into treatments for BFRBs, which is body focused repetitive disorders, which is under that umbrella of OCD. And the body focused repetitive disorders are, a few of them are the skin picking, the hair picking, the lip picking, the pulling of the hair. Those are under that body focused repetitive behaviors. Let's see. It's grown in the past 10 years. So, although no one treatment has been found to be effective for everyone, a number of evidence based treatment options have shown promise for many people. I would have to say that no one's the same. Oh, here we go. Learn more about other BFRBs, medications, and treatments. Cheek biting, nail biting, skin picking, and hair pulling all fall under that BFRB tag. The TLC Foundation for Body Focused Repetitive Behaviors. TLC Foundation, and this is specifically for body focused repetitive behaviors. Find support, learn about it, your journey. clinical training and research. I hope I'm not messing you guys up by just flipping through this really quick. But it's a really long article and I do not want to read it. So we will not read that. I'll come back to StreamYard. We'll go, we're going to go to the Picking Me Foundation's website about Laura, who I talked to you earlier about, and how she is helping by creating a community where you can discuss any issues you have with your skin picking disorder or hair pulling or nail biting. The other one was cheek biting. I actually think my mom does that. She doesn't think it's an issue. I might have to look that up. But anyway, so let's check this other article out. So let's go to present. Oh, I'm going to open the PDF file. Well, we're going to share screen so you guys can see what I'm doing. Okay. Share. Okay, so you can see she has these like posters, and when you click on them, it takes you to a PDF. So what we're going to do is we're going to go to the top. Okay, we have dermatillomania and eczema, skin picking disorder, and monkeypox. Apparently that was an issue. Acne and skin picking disorder, back to school tips with skin picking disorder. Okay, dermatillomania during COVID-19, dermatillomania and tattooing. Okay, feeling fidgety, fidget tools. Avoiding the triggering effects of mirrors, dermatologist and skin picking tips, tips for skin pickers on mosquito and bug bites. Now you might see that in small children who do get mosquito bites, that they're scratching and picking, and okay. Support and friends with dermatillomania, skin picking and maskne, which we know was a thing that came out of COVID, skin picking and acrylics, skin picking and infections, fidget tools on Amazon Prime Day she did, dermatillomania during winter, dermatillomania in Zoom, friends in dermatillomania, lip picking tips. That one I do want to read. Dermatillomania and ingrown hairs. That's just page 1. We'll go to page 2 and see what else I can find. But if you go here, she has the About page, my story, what is dermatillomania, the mission of this, initiatives, pledges, drawing with dermatillomania, Picking Me poetry, share your story, our community, donate, volunteer sponsorships, event calendars, resources, management tips, online support groups, derma resource packets. And she does a lot of work in communities, especially Skin Talk is her blog, and mental wellness. Picking Me Foundation 7th annual fundraiser. Okay. So what we're going to do is go back to that page. So what I need to do is go close this and go back. All right. And tips for skin picking disorder piercings. And then share your story. This is a community. It's a community. They created a community and support groups. I have given them my email so that they may contact me with news and updates. And her name is Lauren at pickingme.org. Okay, so we're going to go back to page 1, and I'm going to look at the lip picking page. And what you have to do, so you scroll down. This is Feeling fidgety. Here we go. So what I'm going to do, since I can't read it like this, I'm going to click on it. It's going to open a PDF for me. And then I'm going to open the PDF. So I'm hoping you guys can see this. I'm going to go to stop screen. Still here, sorry. Present. Share screen. Let's see if that's, it's not available on here. Select a tab to share. Choose tab, window. Let's see. Oh, we can share the window. No, that's StreamYard. Entire screen. I thought I was able to do that earlier. What has happened? Okay, so I'm just going to put you on present, share screen. We're going to do it this way. And then share. I wonder if I can make it bigger so you can see it. All right. Large. Okay, lip picking tips. And this is because I need this. Lip picking can be a form of dermatillomania where strugglers compulsively pick, peel, or chew at their lips area. It is a BFRB classified in the DSM-5 under OCD-related disorders. It can also be exacerbated by chapped lips. Yes. Emotion regulation and excessive finger energy causing lip tissue damage. Shame and impedes quality of life. Check out some of our tips below. Keep your mouth busy by chewing on things like sunflower seeds, alfalfa sprouts, chewing gum, chewable jewelry. Regularly applying lip balm and leave multiple out in visible locations. Okay. Try an exfoliant lip scrub to remove dead skin, which I do. I actually have I have the cherry one. Spray perfume or scented oil on your wrist to alert you by smell when your hands are picking your lips. Wear jingling bracelets to give you the auditory alert that your hands are near your face. Put on a mouth guard while working, studying, or whenever you pick the most. Wear bright lipstick as a barrier from getting it on your fingers. Nibble around unpitted olives. Suck on ice cubes to numb lip sensation. And those are the, but I do use a lip exfoliator so I don't feel the dry skin. I do that. So, I have done that. Hi, everyone. I have to go. Thank you. Hope you have a great day. You too, makeup nurse. You too. Have a great day. Let's see what time it is. It's 2:53. All right. So I think what I'd like to do is next week I'd like to talk about the nail biting, which one of our wonderful people in our chat brought up, because I have done that before. I don't do it normally. I think it's because I'm a germaphobe, to be honest with you. But I do pick at my cuticles. I don't know if that's under there, unless that's under dermatillomania. And I have to be careful because I will take those nippers and I will go to town and then my fingers will hurt. So, yeah, put me up here. So I'm thinking for next week, that's what we're going to do. We're going to do nail biting. And that makes it easier for me if I know what I'm doing next week. So I don't have to worry about finding something. So I want to thank all you guys for coming today. This was so great. I'm glad I got to see you guys again and that you listened to me talk and talk and talk and talk. I appreciate it. I appreciate all my friends here on YouTube. And I don't know what else to say. If you guys want to put a comment down in there, I can answer questions. We have just a couple minutes left. We have 5 minutes. So if you have any questions about anything, not even skin picking related, we can do that right now. And I had my chapstick here because I knew my lips were going to get dry. I was going to want to scratch them. So I have my Lips Schmackers Unicorn chapstick. Hi, Shelly. How are you doing? Oh, it's so good to see you. How have you been? Oh, don't worry. Don't worry. We got about 5 minutes left. If you have anything you want to chat about, feel free. But yeah, we were talking about skin picking today and lips, picking at your lips, picking at your face, picking at your head, what that is, and some things that might help you to not do that. But it is a mental health condition, and we need to understand that and be sympathetic about it. So that's basically what we've been talking about the whole time. So, okay. I don't see any questions. So, let's see, what do I have here? Live chat. I'm okay. Haven't been doing that good since my fur baby gained her. Oh, did you put? Was it your dog or your cat? I'm so sorry. That hurts. That hits the heart, right? Yeah. Especially when you're like us and we love animals more than people, right, Shelly? Yeah, I'm so sorry to hear about that. Yeah, your puppy. Okay. Okay. Well, I hope that you are on your way to feeling better. I know that that's going to take some time. I know that from experience. Yeah. What I do is once the pain has, like, where I can speak about my pet without bawling my eyes out, then I usually go and, yes, I'm not a human fan, but I love my doggies, right, Shelly? They're right here in our hearts. They're right in our hearts. But people, except for our friends here in this chat, we love these people. It's just stupid people we don't really like. And everybody here is beautiful and intelligent. And also funny. Everyone in my chat is also funny. Geniuses. Okay. I think I'm going to let you guys go then. And again, Shelly, I hope you feel better soon. I know it takes some time. I know that. But I usually get another pet because I don't do well alone. I need some companionship. And nobody loves you like a pet loves you unconditionally. We like to hope so. I hope my husband does, but sometimes I irritate him. I don't irritate my cats. It's been a month since she's been gone, and I keep hearing a squeaky dog toy. Oh, Shelly, that's so hard. That is so hard. Yeah. Especially if it was unexpected. If she wasn't sick, like, to begin with, and just unexpected. Yeah. Okay, I'm going to let you guys go. Okay, you still have a puppy. Okay, that's good. That's good. Is your male dog, is he noticing that she's missing? Were they like really, really close? Like when my Rue passed away, my Lily, she was like, "Oh, yay, I'm the only dog in the house again." Have a great night, everybody. I'm going to let you guys go. I will see you in the next video. bye, everybody. I will be back next Wednesday. I plan on it. And so hopefully we'll get back to a schedule at least till next summer. So have a great day, everybody. Bye, everybody. Bye. I'm trying to hit it with my finger. It's not going to work.